All right. Trying out the new features tonight. So it's a new feature on Instagram that lets you do Q&A. So got a few questions answered tonight. Thank you for joining. I think that's Chris from Kentucky. How's the knee doing? All right. We'll go about another 30 seconds for a few more people to join on. We got this going on Instagram and also got a few people on my Zoom call. So for the people on the Zoom, you're not going to be able to see the questions. I'll just read them out loud. And but if you have any questions on Zoom, just type them in the chat box and we'll go over those tonight. The knee advice. You can see the red light behind me. You need a lot of photobiomodulation or red light on that knee. Get the swelling to go down and improve the blood flow to that area. So yeah, text me when this is over. I'll give you some more tips and tricks. All right, good evening for the rest that are joining. So we'll get started here. So I'm Dr. Michael Twyman. I'm a board certified cardiologist. I focus on heart attack and stroke prevention. And I got into the biohacking scene in 2017 when I was going to a trip in Asia. It's about a 14-hour flight from where I'm at in St. Louis right now, and I didn't want to die from the jet lag, so I wore these funny colored glasses on the plane to kind of figure out how to cut down on the bright light that would affect my sleep cycles. You know, how do you improve your circadian rhythms wearing blue, black, and glasses? That was all that kind of stuff, and because the jet lag wasn't so bad, I figured there must be something to this circadian rhythm management. So been looking deep down the rabbit hole on how light affects health since that time. And then that's led to many other things that ultimately had me break free from the hospital system and start my own practice where I can focus on the root cause of, mainly cardiovascular disease, but also focusing on optimizing longevity. Some of those who already know me, I did have a great grandmother make it to 106 years old. I call this kind of mission 106 plus, that I'm trying to do all the health optimization stuff that I can to try to beat her longevity record. So, and I'm gonna try to take you guys along on that journey too. So thanks for joining us tonight. And tonight we're going to do just an open Q&A. It can be about cardiovascular disease, biohacking, health optimization, longevity, sleep, whatever you're mainly interested in chat about tonight. We'll try to answer it. But we got a few questions from people who wrote in earlier today. So first question I have is recommendations for improving heart rate variability, or HRV. So first off, what is heart rate variability? That's the beat-to-beat difference between every ventricular beat. So normally the atria, the top chamber beat, the bottom chamber, the ventricle beat. If you do an EKG, you can see the different beats. And from one ventricular beat to the other ventricular beat is one interval. As you breathe in and out, those intervals are supposed to contract and expand. It's not supposed to be a metronome where your heart rate's just going 70, 70, 70, 70. So the further it expands out and in, the more variability there is. That's a marker of how much stress is on the body at that point. It's also a good marker for athletic recovery. So many athletes will check their heart rate variability in the morning time, set a baseline for a few days, and then as they're exercising, if the heart rate variability is going down, their body may be under more stress and they may not want to be pushing it that hard that day. They're more likely to get injured if they have low heart rate variability. Low heart rate variability can also be associated with coming down with an infection, and now during this pandemic, that's a not the be-all, end-all early warning sign, but if your heart rate variability is much less than your normal baseline, start monitoring your other symptoms, headaches, fever, shortness of breath. Are you coming down with something? So the question first is, how do you improve it? Well, you actually have to first measure it. So there's different measuring devices for heart rate variability. I use a couple different ones. One of them uses Elite HRV. It's like a pulse ox finger probe. And I use that one in the morning time to measure the blood flow in the fingers. And then it's like a 2.5 minute breathing drill. And then it gives you a baseline number. But then it also gives you all the kind of the quantified math nerd stuff that if you want to look at it, it gives you much more information. And then I've also previously used a chest strap, a Polar H7 chest strap to record the HRV measurements. There's a couple different manufacturers of the meters. I've not played with the newest Apple Watches. I think there's a feature for heart rate variability, but I'm not a big fan of wearing an electronic watch with cell phone signals and Wi-Fi pinging my wrist all day long, so I tend not to wear anything digital on myself during the day. Typically, I'll measure my HRV with the late HRV in the morning time, and I'll measure my overnight HRV with an Oura ring, the OURA ring, which I've talked about in my 2 previous series on sleep optimization. But I'm also now playing with the new device, the Whoop band, which kind of looks like a watch, but there's no data that you can see on it. It's all hooked into your phone. Yes, it does all the usual fitness tracking, but some interesting features on it that I'm still exploring. There's a strain feature, which kind of takes into effect how well you're sleeping, how much exercise have you been doing, and then it's measuring your heart rate variability, your respiratory rate, and then comes up with a score, how stressed the body is, so should be pushing it that hard during an exercise routine or not. It also does sleep tracking, as mentioned, so I'm trying to compare it apples to oranges, how well is it tracking compared to the Oura ring. But it does measure heart rate variability. So first you got to get kind of a baseline of your heart rate variability, and then you can see what you can do to, quote, improve it. So, number one thing is sleep better. If you sleep better, your heart rate variability tends to improve. So, figure out what's breaking your sleep, and if you need help with that, like I said, there's 2 videos I did in the past 2 weeks that go over that data. But, acutely, if you're not having an acute infection, focus on stress relief. So meditation, yoga, mindfulness, heart math, clip it to your ear, do the breathing exercises. That's measuring your heart rate variability. Does these things that can improve your sympathetic and parasympathetic tone so that heart rate variability expands better. And then I'm also playing with a new device, the Apollo Neuro, that clips to your wrist or clips to your ankle and gives you these different vibrations. There's, I think, 5 or 6 different, let's see, 7 different programming things you can do on it. There's energy and wake up, meditation, mindfulness, rebuild and recover, clear and focused, social and open, relax and unwind, sleep and renew. There's apparently some interesting data on using this to kind of reset that autonomic nervous system throughout the day, doing different vibration patterns. And there's at least report that it's supposed to improve your heart rate variability. So I'll be playing around with this and see if it actually improves my heart rate variability. But great question. All right. Welcome to the rest who have joined. Thank you. We're going to run through a few questions here tonight that have been pre-entered, but if you have any more questions, I always happy to answer them, so just throw them in the comments. Let's see. We'll switch up a little bit. Do I recommend any food sensitivity test? The general answer is no. I haven't personally found one to be all that useful. There's different assays. I think it tends to be more useful to just listen to your body after eating certain foods. If it doesn't agree with you GI wise, or break out in sweats, rashes, or if you're measuring your heart rate variability, that is a fairly sensitive marker. If your heart rate variability gets crushed, maybe you're sensitive to something. So many people are sensitive to gluten, dairy. Those are kind of the 2 biggest offenders. So potentially do an elimination diet and then introduce things back and see how you respond to those things. All right. Next question. Can I please go over how to maintain vitamin D levels during the winter months? So this is a topic that is very near and dear to all my cardiac patients that see me at Apollo Cardiology here in St. Louis, but it's also very important as a marker of your immunity for, what's your susceptibility to getting COVID and how bad of a case would you get it if you actually contracted the virus. So, your vitamin D levels, if you're less than 30, you're deficient. What is optimal? Yeah, it's kind of a moving target, but I typically recommend patients get levels between 50 and 60 without supplementing with vitamin D. Vitamin D is much more important than what it is in a pill. There's many, a couple hundred different reactions that happen on the skin surface in response to the way that the light hits the skin. The UVB radiation is what sulfates cholesterol into vitamin D. But in certain areas, especially where we're at currently in St. Louis, the the sun's angle of inclination isn't set up where UVB is going to get through the atmosphere, and you're not going to make vitamin D no matter how much skin is exposed in St. Louis this time of year. So I typically recommend patients use the app called D-Minder Pro. It's free. It helps you track your vitamin D exposure and tells you what time of day to be outside. But ideally, you build up a big solar kind of callus through the summertime and into the fall. So you're building your vitamin D levels up, and then they would naturally decline in the wintertime. Can you supplement with oral vitamin D? You can, but you need to be under the guidance of a physician monitoring your kidney function, your thyroid function, calcium levels, make sure you don't have an issue with that. So you don't want to willy-nilly take a bunch of oral vitamin D. For those that know what they're doing, there are different UVB devices that can be acquired, but you do have to read the instructions exquisitely so that you do not burn or injure yourself with those devices. But probably my favorite way to optimize your vitamin D through the wintertime is be like a bird, fly south, go below the 20th latitude if possible, and soak up some sun for 3 or 4 days, and then come back north. That should give you a boost for 4 to 6 weeks. So maybe make 2 or 3 sun runs in the wintertime if you're not getting UVB all year long. Great questions. Let's see what we got. What's the next question here? Question is, do I counsel my patients on lowering insulin? If so, what strategies would you recommend? Well, it sort of depends on what do you mean by lowering insulin. Why do you want to lower insulin? If you're somebody who has, insulin resistance or diabetes, you got to figure out, what other things are going on. So typically, I'm not going to necessarily recommend that you're taking a medication to, quote, lower insulin. It's fix something in your environment that's first breaking it before jumping to medications. So first off, sleep well, get your, 8 hours of sleep, when your body is supposed to repair itself. If you're not sleeping well, you're not going to have good glucose control. You will typically become insulin resistant in your muscles first and then your liver. So your muscles, dispose of the majority of your glucose, like 80% of it. So resistance or strength training is really key, a couple times a week. The more muscle mass you have as you age, the better you tend to age. If your muscles are pulling in the glucose, you don't need as much insulin to push it in there. There's non-insulin ways to get glucose into your muscles through this receptor called GLUT4. The other things that can help lower insulin is, limit your artificial light at night. You can always see when I do these talks post-sunset, the room's always lit up red because I won't turn on a bunch of white junk light at night. Artificial light at night can spike your glucose and your insulin, irrespective of any food that you're putting into your system. All right. Question, when I sleep on my back with my hands on my chest, my hands fall asleep. Cause for concern. I guess it would depend on a little bit, does it happen any other times a day or any way that your hands are positioned differently? Sometimes I get concerned that there's quote, pins and needles sensation in your hands when you sleep. Sometimes it's a marker of carpal tunnel syndrome. So if you're banging out a lot of stuff on the computer all day long and it's just firing up at nighttime, maybe that's something. But you need somebody to check your hands. You can kind of do it on yourself. Squeeze your fingertips and see how fast the skin turns white, and when you let it go, how fast does it turn red again? That's a marker of your capillary refill reflex. So how fast does the blood flow come back to your hand? I don't suspect that you would have a severe vascular problem to both hands that would be causing that. But if your hands are kinked down like this, you can get that pins and needles sensation. So not likely something major, but look at it. Is it happening more during the daytime or when you're exercising, or something else that can be triggering it? And then I don't know who this person is, but I always thought it was pretty funny that it got added into my questions today. So what is the meaning of life? If anybody knows for sure, then please send me a direct message. But I would say my short and sweet answer would be, enjoy the journey and help as many people along the way as you go. That's the meaning of life to me. All right. I think that's all the written questions tonight. So let's see, I got a few questions coming in through my other way. Hey Victoria, thanks for joining, and I got the hotel booked today. So, all right. Somebody's asking, is creatine supplementation healthy for muscle development in a post-menopausal woman? So creatine can help with basically strength improvements and does make the muscle basically swell a little bit more, it holds on to more water, so can be a healthy option. Typically don't recommend people bolus with it like they used to. I personally had a bad side effect using too much creatine, so I'm a little bit skittish on myself using it. But typically, if you use it as directed on the supplement and don't do the loading phase, usually things will be okay with that. Then there's a question on calcium supplementation vis-a-vis heart health in postmenopausal women with normal demand scan. I anticipate that means maybe a normal DEXA scan, which would be a bone density scan. I don't know what a demand scan is off the top of my head if it's not a DEXA scan. But bone metabolism is a little bit more complicated than just calcium. You need proper vitamin D levels, you need proper vitamin K, especially K2 levels, to push that calcium and keep it into the bone. So if you're getting your calcium supplementation through your diet, green leafy vegetables or dairy, if you tolerate dairy, I have no concerns with that. But the challenge when people are taking milligrams to grams of calcium in a supplement, if your body's not optimized with vitamin D and K2, that calcium may end up going in other places you don't intend. It might get stuck in the arteries. So you want to be careful with oral supplement with calcium. Unless there's a really strong reason to be on a lot higher doses than maybe 500 milligrams. Somebody's asked me if I consulted on a COVID treatment for any of my patients who have contracted the virus. If so, please elaborate on how you arrived at your recommendations. I have not treated any active COVID patients, and at this time I don't plan to get into that treatment. The protocols keep changing, and I'm really focusing on outpatient medicine at this stage. So there are different protocols for the real sick, hypoxic patients ending up in the hospital. I don't keep up on those because I don't round in the hospitals right now. I have some ideas on what I could do for if people had initial cases or mild cases and were at home. I can give them some recommendations if they're my current patient. But the basics, you may be exposed, so build up your immune system so that you're more likely to get a mild case. That's always going to be my kind of blanket statement. And how do you do that? First you have to sleep well. We talked about those for the past 2 weeks. If you don't sleep well, your immune system is going to be, subpar. Is the easiest way I can say it. And there is some interesting data that for those people who've gotten flu shots in the past, they've done a trial where people were basically sleep deprived, given the immunization, and they did not mount a great immune response towards the vaccine. And so, if you don't get a good immune response to the vaccine, then you're not necessarily going to be protected if you're exposed to the native, flu virus. This is likely to be similar to way the COVID vaccines were. I don't have any insider knowledge exactly about that, but my personal recommendation would be if you're a candidate for the vaccine and interested in getting it, make sure you're sleeping well 3 or 4 days before you go get the vaccine, so your immune system has the best shot at making a good immune response. And the second thing is the question I answered earlier about vitamin D. Ideally your vitamin D level should already be 60 before you came into this winter. If not, can you supplement? You can, but make sure you're doing it under doctor's direction so that you know where to target your dose and that there's no other untoward side effects from doing it. But if you have the means and can do it, doing the sun runs down south and soaking up a lot of sun during this time of the year, the sun hitting your skin programs the T regulator cells and boost your immunity. So if the sun is the cure to many viruses, I would seek Mother Nature's way, in addition to if you're going to consider getting one of the upcoming vaccines. All right, I think I have a couple other questions on the Instagrams. So let's see. There's a question, which photobiomodulation device would you recommend? Really depends on what you're trying to treat. I have multiple different manufacturers and they all do a little bit different thing. I have a Weber laser helmet if you're trying to do brain irradiation. I got one sitting on my desk here. I got the Weber Spectra Watch, which does photobiomodulation to your radial and ulnar arteries. So you wear it on your wrist and it puts 4 different colors of light directly into the arteries. I have 2 separate portable devices that are battery powered. One is all red, one is red and infrared. And then the big one I got behind me is my EMR Tech Firewave. Those are kind of the main ones that I use. Okay, got another question coming off my Zoom feed. So, is there a clinical relationship between hypoglycemia and heart disease? I don't know exactly how to answer this as a absolute, but hypoglycemia or low blood sugar, is generally going to be more deleterious than high blood sugar. So depends on what your definition of hypoglycemia is. If it's symptomatic hypoglycemia, where you're getting sweats, becoming confused, almost losing consciousness, then yes, that would put significant stress on the heart. You're going to dump cortisol, adrenaline. That's going to put a lot of stress on the vascular system. But if you have generally low-ish blood sugars, I don't have a direct pathway why that would cause more issues with heart disease. No, you're welcome. Thanks for asking the question. So let's see. I was trying to play around with some of the new features on Instagram. They said there's a live Q&A thing now. I'm not sure exactly if I got that fully working, but it looks like it's doing okay. We're waiting for any other questions to come in. If anybody has any comments or suggestions on future topics, always happy to entertain those. We've done a couple on sleep this week or this month. We've previously done many on photobiomodulation. I've done a couple on lipids 101, lipids 102, and lipoprotein A. Potentially maybe next week I'll start going back to a little bit bread and butter, cardiovascular, heart attack, stroke prevention, kind of go through the kind of my triad of testing that I would consider getting done to look at your risk, and then we could talk about the lifestyle things that improve that. Oh, this is a good question. Am I using the X3 bar and would I recommend it? Yes, I am using the X3 bar, and give me 2 seconds. So for those that haven't seen the X3 bar, this is what it looks like, a couple different bands. So it's an interesting piece of resistance equipment that I've had pre-COVID, so I was happy that I actually had this device so I can still do many of the exercise that I want to do at my own home. But the X3 bar is something that it's no joke. You need to read the instructions to know how to do it without injuring yourself. I've had no major injuries using it. I should take that back. So it's very strong latex that is not like the usual little PT band. So there's a couple 100 pounds of force if you use the super thick band. So it looks like a tire. So let me run through my slight injuries with it. So once I had the metal bar and the rubber band, I was getting out of it and jumped back, caught my head, got a nice little bruise, no sutures required. Probably wasn't doing the best deadlift form with it, so had some mild low discomfort in my back for a couple of days, and used red lights, and that got it better. So red light for the win. And then the most significant one, it was my own fault, but I was playing around with the one that looks like a tire, and that's way too strong for me. I'm not that strong. I'm definitely a hard gainer. I'll do the work, but I'm not putting on muscle like the guy who invented the thing for sure. But put on the highest thing, and like I could do a couple reps. I was like, this wasn't so bad. And next day I could not like move my left arm over my head. I thought I like jacked up my rotator cuff. It was just intense pain in here. And then once I kind of did my ortho exam, which I'm not the greatest because I'm a cardiologist, but I was able to figure out I jacked up my bicep tendon, so I got it very inflamed. So took some anti-inflammatories, rested for a few days, and then used a whole bunch of Photobiomodulation, throughout the day to lower the inflammation in that area. And then a couple of days, swelling went down and the pain went away. But the X-ray bar, it's an interesting device. They were running some specials on Black Friday. I don't know if they're still running any specials on it, but it's my personal favorite resistance device currently, just because of it doesn't take as nearly as long as some of the other things I used to do. If you're trying to get huge, it's probably not the right thing, but for quick and dirty, it's a good one to start with. What continuous glucose monitor do I recommend? So the one that I typically use with my patients is the LibraLink 14-day monitor. It syncs up to your phone. It's decently accurate, but if you're a type 1 diabetic or you're somebody who really needs to get the data, probably the Dexcom G6 would probably be the one I would recommend. Challenge with that one is that unless you're type 1 diabetic, insurance is not going to cover that device, and that's going to be the device itself is a couple $100, the sensors are a couple $100. So I think I saw somebody say it's about $8 to $10 a day to run the Dexcom systems if you're not having that thing covered by insurance. So unless you're a hardcore biohacker or just need super accurate data, probably would go with the LibraLink. It's directionally accurate. And if you're in the St. Louis area, I do offer those to my patients. All right. Well, we're coming up to the half hour, and so I usually try to wrap it up here. Keep you guys entertained, but not stuck listening to me drone on for an hour. But thank you for your attention, the great questions tonight. I'm always happy to help. I'll be doing these chats every Monday night, 6 o'clock, and the topics. They're always going to vary, and I always listen to feedback, and we'll tailor to what you guys are interested in talking about. Next week probably we'll do some heart attack stroke prevention. So it'll be the 3 best tests to get to know if you're low risk or high risk of having a heart attack. So that'll be the topic next week. And if there's other topics, we'll do them as we go. So thank you guys for your attention tonight. I'm Dr. Michael Twyman. I'm the biohacking cardiologist, the heart attack and stroke prevention expert. I practice at Apollo Cardiology in St. Louis, Missouri. If you're interested in working with me, send me a direct message or come to my website, drtwyman.com, and we'll take it from there. So have a great night, and we'll see you next week.